Welcome to this week's SnapCare webinar. Today, Lydia Dunsford from Boys Turner will be discussing Section F of an Education Healthcare Plan. This is the definition of an Education Health and Care Plan, which is a legal document which describes a child or young person's special educational need, the support they need, and the outcomes they would like to achieve. So it's over to Lydia to tell us all about Section F. Thank you, Lydia.
Thanks, Sally. My name's Lydia. I'm one of the education solicitors at Boys Turner, and it's a pleasure to be here. I've worked with Sally before on a previous webinar that we did back in the summer now, and it's nice to be back again, particularly at this time where we're in lockdown. The situation for children with EHCPs is quite uncertain, particularly in terms of schools. And provision for them in terms of their Section F of their EHCPs, and if they're at school, and what should be happening. And that is one of the sort of set questions. It's my last set question, so I will be talking about that at the end. As Sally said, if you've got any questions, please just, either put them forward for us to address at the end, or if you don't understand something that I'm saying as I go through, then obviously please ask as we go along. So there are 5 set questions. Ones which we get asked quite a lot as well, about Section F of an EHCP, which is arguably the most important, purely because it sets out what educational provision a child or young person needs, what must be delivered to them. And this is often the section which is mainly disputed by parents or by young people, and it's very, very important to get it right. So question 1 that was put to me was, how specific does Section F need to be? Generally, it's as specific as it needs to be, so it's clear, unambiguous, detailed, quantified. You want it to make sense, so if someone picked up that plan, they would know what provision is that child or young person needs, if it's on a one-to-one basis, if it's in a group, how many people, is there any detail about the other needs of those pupils within that group, how often provision is going to happen, is it weekly, twice weekly, daily, for how long, is it half an hour, 10 minutes, 1 hour? That's the sort of level of detail we want to see. You also want to be looking for who is going to oversee that provision, obviously who's going to deliver it. We often see references to an adult support for a child, which is incredibly vague. And in most cases, you're going to be saying, well, who is that adult? Is that a TA? Is that a teacher? Is it a therapist of some kind? So you want to know who specifically is going to be doing that, any qualifications, experience they need, any training. You also need to factor in time if there is going to be training for staff, therapists to give training to staff to deliver programs to children, therapy programs. So factoring time for that. And also time for almost admin side of things as well. So monitoring and review of that provision. Does a therapist need to be involved to be reviewing the programme to make sure it's still appropriate, still working, and also factoring in time for that therapist, professional, whoever's involved with that young person or child, to prepare for the annual review of the EHCP, and to contribute either with a report, reassessment, attendance, that sort of thing. So potentially there's quite a lot that you're going to need to see in an EHCP in Section F, but that is absolutely what's required. There is case law, guidance, galore really out there saying that it has to be this level of detail, and it's always a question of what is required in each particular child's case. So is it specific enough for that particular child's needs? And more often or not, we find that means it has to be a lot more specific than when it first comes to us as a draft plan or a final plan and needs challenging. Second question kind of follows on from that. It's what sort of provision can you ask for in section F? This is effectively, can be unlimited in the sense that it depends entirely on what educational needs your child or young person has in section B. So everything in section B, every need, needs to have a corresponding provision or support in section F. So in that sense, it's basically, it's almost just not say unlimited list, but you can be looking at quite a wide range of things: therapies, provisions, support. Common ones that we see very often are different therapies. So speech therapy, occupational therapy, physiotherapy, input from an educational psychologist, input from any sort of therapeutic support, anything for behavioural needs. Music therapy, we've seen applied behavioural analysis, or ABA, which can be quite a sometimes controversial therapy with local authorities to try and agree to, or even accept that this is appropriate. You may also see provision to do with actual equipment a child or young person needs, things like use of iPads, alternative means of recording their work, adaptations for their seating, writing. In very, very rare cases, you can also see transport in section F as a special educational provision. This is rare though. It only happens in a very small number of cases that we've seen. But it can happen depending on the individual needs of the child. There's also other provision which sometimes involve being outside of a school environment, so like hydrotherapy. You might get it where a child or young person has to travel for hydrotherapy, something similar like that. And something which is often a source of dispute amongst parents and local authorities is one-to-one support, and how much one-to-one support a child should be having in section F, how many hours, rather than just, a high amount of one-to-one, which is clearly not going to be clear enough or sufficient. But essentially the list depends on what your child or young person needs. Question 3, does section F need to confirm funding banding as well? And this is something we get asked quite often actually. It doesn't have to have detail about the funding arrangements, any funding banding that is applicable for section F. But if it does, it mustn't be at the expense of clear and detailed provision. So exactly in black and white what that child or young person has been identified to need, basically. If you've got reference to X number of hours worth of funding, that doesn't say the same thing as, well, actually what provision is that child going to get from that funding? So that's something to be aware of. And also bear in mind that if local authorities are quite keen to say that they need reference to funding in section F, remember that they are the ones who are ultimately responsible for what is being delivered in that section F of the EHCP. So you're looking beyond what the school can deliver through their resources, and anything above that, which is in section F, well, that's on the local authority to provide, almost regardless of what the cost is. That doesn't matter to you as a parent. What you want to make sure is the provision is actually being delivered. Let the local authority and school work out the money between them. There may be circumstances where you as a parent come to an arrangement with a local authority about funding section F or something different, but generally in most cases it's on the local authority unless agreed otherwise. Question 4, and this is something which we find is often a source of issue for local authorities and parents who come to us saying they've been told one thing by a local authority and we say actually that's not true, is can you have independent experts providing recommendations for section F? You absolutely can, of course you can. And from our experience actually, we found that independent expert reports are often clearer and more detailed than those of a local authority counterpart. You may find, and we have found this in the past, that local authorities may say, no, we can't accept an independent report. Our policy doesn't allow that. That's a big red flag, really, because if they're saying that, it sounds like it's a blanket policy, which is unlawful. For the purpose of an EHC plan, for going through the process to get a final plan, parents often do go down the route of getting independent experts because often they have no other choice if local authorities either haven't assessed for a long time, or they have assessed but the reports really just aren't up to scratch and they don't say anything of particular use or anything specific about the provision that the child or young person does need. If you are at a stage where you're looking to challenge your EHCP, the Section F provision, to the SEND tribunal, then again, this is often the situation where independent experts are really a good source, and parents often instruct them. We instruct them, on behalf of parents, to help really get the content of the EHCP, including Section F, up to scratch, and what legally it should be saying, basically the level of detail it needs. And I suppose the thing to bear in mind with instructing any experts or dealing with any professional is be clear on what you want them to do. What do you want them to provide and comment on? Having clear instructions from the off, and clear kind of reasons of what you're looking for. So you want your Section F provision to be a lot clearer and more detailed. You want there to be recommendations about one-to-one or therapy support. That's what you need to be saying to an independent expert, so they know what they need to put forward. The last question, which is one with probably the longest and not most straightforward answer, is about what can you do if your local authority, who are responsible for your plan, what happens if they're not delivering your Section F provision? Now, if we were in pre-COVID times, this would be a very simple answer to give. Because we are in COVID times and we are in lockdown, there is almost ever-changing, sort of daily, almost ever-changing guidance, recommendations, updates about what local authorities need to be doing with EHCPs, with Section F of those EHCPs, and also with children and young people going to schools with those EHCPs. So I would say from the off that EHCPs, they're still in force, they're still valid, they're still there, and the timescales around issuing, preparing these plans are still there. They haven't been changed or altered because of lockdown. What has changed, or was certainly less clear than it was before COVID and lockdown, is what local authorities need to be doing in terms of Section F and delivering that provision. So since being back in lockdown from 4th of January, there have been different sources of government and legal information, advice, guidance as to children and young people's rights and parents' rights for Section F provision being delivered. It's not clear information, and we've, but in our team, we've had a look at it, and actually some of it is a bit contradictory. It's not particularly clear. So we'll say that from the off, but I can certainly give an outline of what we have found to be the key points about Section F in lockdown, and appreciating that it can be slightly difficult to work out exactly what should and shouldn't be happening, but hopefully this will kind of help give you an overview of what to kind of expect. So government guidance, as you're probably all aware, is that schools are to remain open for children who are vulnerable, and that includes those with an EHCP. In some cases, it is actually going to be deemed safer, however, for that child or young person to be at home being taught for whatever reason. If that's the case, there's a very, very long act, which I will read in full. If they are at home and they've got an EHCP, then the Coronavirus Act 2020 Provision of Remote Education, England, Temporary Continuity Direction, which is a bit of a mouthful, says basically that your child's school or young person's educational setting, they have a duty to provide remote education in accordance with whatever is the latest government and advice and law at the time. So in essence, they should still be getting remote education at home. This applies to basically all schools which are funded by public funds through the EHCPs. In terms of what local authorities need to be doing, unlike the lockdown last year, when the government lessened their legal responsibility to deliver Section F, and they brought it down to one of reasonable endeavours, which caused a lot of issues, a lot of confusion and uncertainty about what that actually means. At the moment, as far as we can tell, the government has not done the same thing again. So local authorities still have an absolute duty under Section 42(2) of the Children and Families Act 2014 to deliver your Section F provision in your final EHCP. So that has not changed. But what has sort of changed slightly is that, and this came from a letter from the Under Secretary of State for Children and Young People, Vicky Ford, on the 14th of January. She said that actually in some circumstances in lockdown, it may be more difficult for local authorities to meet that Section 42 duty. So it may be more difficult for them to actually deliver what your Section F provision says. If this happens, and this must always be assessed on a case-by-case basis, this is not a blanket kind of application for all children with EHCPs who have some sort of Section F provision. It is on a case-by-case basis. Local authorities need to work with you as the parents, as the families, with the schools, with health partners if applicable, and work out a suitable arrangement which is in the child or young person's best interest, work out how to monitor the alternative provision that they're going to be getting. So that in a way almost reads opposite to what they should be doing under the law, which is delivering exactly what the provision says. So there clearly may be times when actually that's not possible, and therefore they need to have that contact with you and schools to work out an alternative for kind of alternative, as close to arrangements as possible for the provision. Regardless of it being lockdown or not, you want to make sure your Section F provision is clear, which goes back to my earlier points about making it so clear that if someone picked up this EHCP, they could read what your child's needs are and what provision they need, how often, by whom, etc. I will kind of summarise basically my last little points on this because I'm conscious of time. Essentially, if you've got a situation where a provision isn't being delivered, factor in the above points I've just made about lockdown, the changes in guidance and local authorities' duties and what schools have to do. Have dialogue with the local authority and the school. I think that's key anyway in the current situation, is to have dialogue. If something isn't quite working, can something be done to change it? What does your Section F say? What is the school providing? What are they able to provide? What provision can be provided at the moment if the child's at home, at school, etc. Depending on what you then responses you get, you parents do have rights to first speak with their school setting as a starting point. You've then got an option of complaining to your local authority, again factoring in the points about the uncertainty and what should be happening with Section F and delivering that at the moment. I'll put this information will all be in the fact sheet that will be sent out to you afterwards anyway, so I won't go through it completely, but complaints to local authorities can then be escalated further, either to the local government ombudsman or judicial review, which is kind of seen as one of the most costly, potentially time-consuming options. At any stage, we would say get advice if you're not sure about what should be happening with Section F, particularly at the moment under lockdown, because guidance is changing a lot. But the things to bear in mind and the key points are EHCPs are still there, still valid. Your provision should be being delivered, However, there clearly are going to be circumstances, the government has said, when that's not going to be possible. So it's a case of assessing it on a case-by-case basis, really. And like I said, this will all be put in the fact sheet that I think Sally will put out after the webinar. I have seen that there's a couple of questions that have come up. Do you want me, either from Sandra, do you want to read, shall I read them out and answer them, Sandra? Or would you like someone from Sally or someone to read
Sandra,
it?
do you want to unmute and ask the question? Because you maybe can then fill in
I can ask.
the background.
So our local authority, their latest cunning wheeze is to get children who have quite expensive provision and then flip them over to the Red Balloon online school of the air, or whatever they call it, because it's a fraction of the price. But in our case, they tried this, and our son has been told very specifically by an expert that remote and online education is not suitable for him. Been told that quite categorically. And again, in the various lockdowns, again, the school has been providing remote education, but he just can't engage in that way. So I don't quite know what the way forward is when you're looking at the Section F. And the response to the local authority when I've said this has been, well, you need to hire teachers and set up a school for him and we'll reimburse you, which I don't think is in the spirit of the law, to make me the local authority and then the accountant. So I'm not quite sure what their legal obligation is here. You know, can they just fling all the responsibility back to parents for monitoring the quality, for example, and determining what's needed?
No, I mean, they're still responsible, you know, between them and the school, they are responsible for making sure it's suitable. So if you've got experts saying remote doesn't work, then, you know, your school and, you know, local authority need to think of something alternative. Yeah, it's the responsibility is still on them, because whatever details you have in the EHCP, hopefully about monitoring and review of the provision, well, that isn't on you as the parent to be providing. You know, that should be still happening between school and local authority, obviously noting lockdown, noting being educated at home. It probably is something
to the
have.
Absence of a, can I just interrupt? It's the absence of any one-on-one provision. I noticed that we've got a question from Lena asking about that everybody's just basically said, yeah, no, we're not going to have any human contact because of COVID, but a lot of what our children get is presumably quite close human contact, and that's function of the EHCP in the first place, you know, that they need a much better ratio.
Yeah, it is, and I think this is a tricky thing with schools. If they are open, they've got obviously pupils in schools, but actually if staff are off ill or staffing ratios are lower, then that clearly is going to have an impact on how they deliver their provision. And again, there's been different guidance about this from what I've seen, about actually schools need to be providing as close to I think it was in Vicky Ford's letter, schools need to be providing as close to what the child would have as possible within the kind of the restrictions, and that's quite open-ended and vague, and you know, you can interpret that as much, you know, one way or the other.
It just flips over to an online model that's convenient for them to run for all the kids, you know.
Yeah, I think there's
no provision.
No, again, it depends what your section says, but also what is the school able to do. If what you've got isn't working, then obviously that needs to be reassessed and reevaluated. I'm conscious of time and there are other questions. If you want to, Sandra, obviously Sally can pass on my email. So if you have any questions after this, ping an email over to me. We can always have a conversation. I'm constantly getting to other people's questions just briefly, if any event. So Lena, right, so that's saying a mum is saying that his child is not being provided in one-to-one due to COVID. So again, so if you're in school, then taking the law as it stands, well then the Section F provision should be happening as it sets out. So if it's got clear one-to-one hours, who to deliver it, then that in theory should be happening. But like I said, there is then differing guidance. Ultimately, law takes precedent, but then there is differing guidance from the government and, you know, the Vicky Ford's letter that says if school cannot deliver what they would normally get, then they need to do as close as, which I appreciate. You know, it's not a straightforward answer. I suppose it's a case of finding out what the school is able to do. What are they providing? Why can't they do the one-to-one? Is it because of is it because of reduced staff? Is it health and safety? What, you know, has there been a risk assessment? What is it? It's, again, it's really tricky. I would say if Sally obviously can pass on my email, happy to have a bit more of a conversation, Lena, just to see if there's anything else I can kind of put forward. Final, there's one from Cara. So it's a question about a TA implementing SALT and OT, speech and language and OT intervention. So basically, yeah, this comes back to I think my second question about, actually first question about who is delivering the Section F provision. So if school or local authority saying, well, the TA can do the provision. Well, actually, if the Section F provision says it has to be delivered by a therapist, well, then it has to be delivered by a therapist. That may be, in the current situation, may be remote. And this happened a lot in last lockdown, was a lot of remote therapy provisions. If face-to-face just wasn't possible. It depends what Section F says. If it's an issue of the person delivering the provision doesn't meet the criteria and the requirements of Section F, then that's an issue to raise with the school initially, and then with local authority if the school aren't able to kind of address that. And then you've also said, if you have an OT and you find out intervention is being carried out by an occupational therapy assistant, can this be questioned? Again, it depends what your Section F says. Some provision is set out to be delivered by a therapist assistant, but that's what it needs to say. If it says it has to be delivered by a therapist themselves, well, then that's what needs to be happening. If it doesn't and it says assistant, then that is fine. Yeah, effectively, that's it. Again, Cara, if you've got any other follow-up questions, feel free to email, because I appreciate a lot of these questions are tricky to answer in a nutshell, and there's lots of follow-on questions that you get, and you know, for your specific situation. I think that's all the questions I can see. If not, like I say, Sally can pass on my email to you. Be happy to speak to any of you with any follow-ups. I think that's it, and timing's pretty much perfect. So
Thank you very much for that, Lydia. I think it is such a huge topic. You could probably do an all-day kind of webinar, really, and never actually kind of, you know, get through everything. But that was very helpful. Thank you. Very interesting. I'm going to just put on the next screen so that everybody can see. There's a few links here, and my colleague Jackie will put those into the chat as well. But we will email them out to you. But I would definitely recommend having a look on Boys Turner website. They have lots of information there, but also on their Twitter. I found that really useful. I've been looking through that, and there's some really helpful sort of information there. And as Lydia mentioned, we will be putting together a fact sheet, so we'll have plenty of information. And yes, I say do have a look at those links as well. We'll email out that last slide so that you've got the information, so don't feel you need to write it all down. And Anita, I'm sorry you weren't able to join us at the right time, but this will, and this is for everybody else obviously as well, this will be available online. We will edit it and post it up online, so you will be able to view it again later. And we are lucky enough to have Boys Turner agree to do a regular webinar for us on educational healthcare plans. So if you have any ideas for what you would like to sort of see in a future webinar, please do send me an email and let me know, and then I can discuss it with Lydia and her colleagues, and then we can put together something, because it's important from, you know, whatever you're coming from, whether you're a parent or a case manager or a support worker, you know, it's about what is of interest to you and what's, you know, important for you to kind of understand and know, have a bit more information about. So yeah, so please do either pop it in the chat, or if you know now, or if you, as I say, just send me an email, and we will email after the event. We'll email you the link to that last page, and also then the fact sheet will have a lot more information in it. And I hope that was useful, and thank you again, Lydia. That was very interesting.
Pleasure.
I feel much more up to speed now with Section S. And yes, it was. Ginny has just said thank you, and first time attending webinar, very useful, clearly delivered and interesting. Very.
Oh, you're welcome.
Yeah, thank you, Lydia.
That's great. Super. Well, I will say goodbye to everybody now then, and thank you very much for joining. We will be having lots of other webinars as well. We'll be having one pretty much every Wednesday. Some of them are for support workers, some are more general. We had a CV workshop last week, but there will be lots of different webinars, so please do have a little look on our website as well, and just see if there's any that you want to register for. And if you could register for individual ones, I think somebody asked if they could register for both, but that does make actually sort of processing the emails quite difficult. So if you wouldn't mind registering for individual ones, that makes life a lot easier. Super. Well, thank you again, Lydia, and thank you everybody for joining us. And we'll post this up, and we hope to see you in the future for other webinars.